Warning: 10 signs of kidney failure. Seniors must know. In the twilight years, every subtle sign from the body could be a warning of a serious condition silently progressing. One of the most dangerous yet often overlooked diseases is early-stage kidney failure. Do you want to know the silent but critically important signs that can help you detect this condition early? Below are 10 warning signs of early-stage kidney failure that older adults absolutely must not ignore. Each sign is a reminder from your body, and if heeded in time, you can avoid severe complications. Sign 1: unusually loud snoring and sleep apnea. If you used to sleep soundly, but now start snoring loudly, intermittently, and often feel tired upon waking, it's not just a matter of aging. Numerous medical studies show that sleep apnea is closely linked to microvascular damage in the kidneys due to prolonged oxygen deprivation. The kidneys require a steady supply of blood and oxygen to function. Loud snoring is not just a respiratory issue, but also an alarm bell for silent kidney damage. Sign 2: persistent fatigue despite adequate sleep. Do you sleep 7 to 8 hours but still feel sluggish, low on energy, and reluctant to move? This could be due to anemia caused by weakened kidney function. When kidney function declines, the body no longer produces enough erythropoietin, a hormone essential for red blood cell production. A lack of red blood cells reduces oxygen delivery to organs, leaving you constantly fatigued, with reduced appetite, and even mild memory issues. Sign 3: persistent itching without a clear cause. Persistent itching, especially at night, sometimes accompanied by rashes or redness unrelated to food allergies or weather, may signal toxin buildup in the blood. Failing kidneys cannot filter out urea and waste, which irritate nerves under the skin, causing widespread itching. If topical treatments don't relieve the itch, consider checking kidney function. Sign 4: dull, persistent lower back pain in the hip-pelvic area. Not all back pain is due to spinal degeneration. Vague, prolonged pain in the lower back, near both sides of the spine, possibly spreading to the hips or lower abdomen, is common in those with kidney damage. Causes may include kidney inflammation, hydronephrosis, or small stones causing congestion. If back pain is unrelated to movement and posture changes don't help, check your kidney function. Sign 5: shortness of breath during light activity. Do you feel out of breath with a racing heart and unexplained fatigue after climbing a few stairs or walking slowly? This could result from anemia due to kidney failure or fluid retention in the lungs because the kidneys can't eliminate excess fluid. Anemia reduces oxygen delivery, increasing heart rate and shortening breath. This breathlessness differs from exercise-related fatigue and may occur even at rest. Sign 6: bad breath or a metallic taste in the mouth. A distinctive sign of kidney failure is breath with a slight ammonia-like odor or a metallic, fishy taste in the mouth despite good oral hygiene. This results from urea in the blood breaking down into ammonia, directly affecting breath and taste. If you lose your appetite or notice an odd taste without a clear cause, consider kidney function. Sign 7: mild swelling in the face, hands, or feet. Weakened kidneys lose their ability to balance sodium and water in the blood. As a result, fluid is retained in tissues, causing mild swelling in the limbs, eyelids, or face, especially in the morning. Swelling from kidney failure, unlike that from standing too long or heart issues, is painless, leaves indentations when pressed, and is often accompanied by other symptoms like reduced urination, rapid slight weight gain, or heaviness in the lower limbs. Sign 8: abnormal urination. Changes in urination habits are critical indicators. These include frequent nighttime urination, reduced urine output despite adequate water intake, dark or oddly odorous urine, or even microscopic blood. These changes signal abnormalities in the kidney's filtration and waste elimination processes. When urine is no longer clear and consistent, treat it as a warning requiring early attention. Sign 9: foamy urine. Foamy urine that doesn't dissipate after flushing may indicate protein leakage due to damaged glomerular filtration membranes. Normally, proteins cannot pass through the kidney's filter, but in kidney failure, the membrane loses its selective function, allowing protein to escape. This is a key marker in early diagnostic tests for kidney disease, even without other clear symptoms. Sign 10: frequent, unexplained muscle cramps. Do you often experience muscle cramps in your legs or arms at night, especially while sleeping or resting? This isn't just due to low activity or cold weather. When kidneys are damaged, they fail to regulate calcium, potassium, and phosphorus, essential minerals for nerve and muscle function. This imbalance causes sudden muscle contractions, leading to cramps, which are more likely at night. Take note. If you have 2-3 of these signs, your body is sounding an alarm. Don't dismiss them as mere signs of aging. Early-stage kidney failure can be managed with early detection, lifestyle changes, and proper treatment. Ignoring them could lead to severe complications, including lifelong dialysis. In the next section, we'll explore effective ways to prevent kidney failure tailored for older adults, based on scientific research, natural lifestyles, and a kidney protective diet. Stay tuned for a surprising factor that can prevent kidney failure at its root, often overlooked by most. If you find this information helpful, don't forget to subscribe to the Key to Healthy Living channel to follow the final part, revealing secrets to living healthily, longevity, and maintaining optimal kidney function. Once you've recognized these warning signs of early-stage kidney failure, the next and decisive step is how you respond. In old age, kidneys are no longer as robust as in youth. Proactively caring for and maintaining kidney function is non-negotiable. Preventing disease early not only helps you avoid dialysis, but also ensures an independent, high-quality life without reliance on medications or medical devices for the rest of your years. Start with the simplest thing, your daily lifestyle. Want to know what impacts kidney health the most? It's not supplements or expensive functional foods. It's your daily habits. Science proves that older adults with disciplined routines, light diets, and regular gentle exercise have more resilient kidney function, with a nearly 40% lower rate of kidney failure compared to others. Here are ways to prevent kidney failure early for a peaceful life in your golden years. Method 1. Adopt a healthy diet, live slowly, eat cleanly. Remember, kidneys dislike salt, sugar, and excessive protein. Eating salty foods forces kidneys to work harder to excrete excess sodium. High animal protein intake increases metabolic byproducts like urea and uric acid, straining filtration. Excessive sugar or refined carbs not only spikes blood sugar but also damages microvessels, including those in the kidneys. Instead, prioritize green vegetables, especially dark leafy greens, radishes, and broccoli, rich in antioxidants and natural potassium to stabilize blood pressure. Healthy fats from olive oil, avocados, and salmon instead of animal fats. Limit red meat and increase plant-based proteins from tofu, mung beans, or black beans, cooked soft, to ease digestion and reduce kidney strain. Avoid processed foods high in salt, soy sauce, MSG, or instant noodles. Method 2. Drink enough water, but not too much. A common misconception is that drinking lots of water is always good for kidneys. Not true. Older adults need the right amount at the right time. Drinking too much in a short period can dilute blood, burdening the heart and kidneys. According to Vietnam's Institute of Nutrition, healthy older adults should drink about 1.52 liters of water daily, sipped gradually. Opt for plain water, warm water, or add ginger slices, lemon peel, or pandan leaves for detoxification. Limit sugary drinks, carbonated beverages, or excessive use of herbal waters like pennywort or kogon grass. Method 3. Gentle daily exercise, healthy kidneys through better circulation. No need for intense workouts. Older adults should maintain light activities like 20-30 minutes of morning walks, deep breathing, meditation, or 15 minutes of qigong daily. These gentle movements regulate blood pressure, enhance blood flow, and reduce the risk of kidney artery hardening. A Harvard study showed that people over 65 who exercise regularly have more stable creatinine levels and 25% better kidney filtration compared to sedentary peers. Method 4. Control blood pressure, blood sugar, and cholesterol. The 3 silent enemies of kidneys are high blood pressure, diabetes, and high cholesterol. All 3 damage small blood vessels in the glomeruli, reducing blood flow to the kidneys and causing chronic damage. Check these metrics every 3 to 6 months. If on medication, follow prescriptions and attend regular checkups. Avoid self-medicating with diuretics or long-term NSAID painkillers, as they can directly harm kidney tissue. Method 5. Reduce stress and sleep well. Restore kidneys from within chronic stress. Interrupted sleep or insufficient rest affects the autonomic nervous system, raising blood pressure and cortisol levels, which strain the cardiovascular kidney system. Deep sleep from 10 p.m. to 4 a.m. is when kidneys recover most. Build habits like sleeping early, turning off devices before bed, and using a supportive pillow to prevent sleep apnea. A good night's sleep is the most natural tonic for your kidneys. Method 6. Avoid overusing medications and unverified kidney supplements. Many older adults use unregulated traditional medicines or heavily advertised kidney supplements. Some contain banned substances, corticosteroids, or herbs harmful to the liver and kidneys with prolonged use. Always consult a doctor before using supplements. If ingredients are unclear, it's best to avoid them. Method 7. Regular health checkups and kidney function tests. Even without clear symptoms, routine tests for creatinine, blood urea, eGFR, and urine albumin can detect kidney failure early. These tests are affordable and available at most reputable hospitals or clinics. Did you know? When eGFR drops below 60, kidneys have lost nearly 50% of their function even if you feel fine. Regular checkups are the smartest way to protect your kidneys. A final surprise, the hidden factor that saves kidneys: diaphragmatic breathing and respiratory care. Few realize that deep breathing profoundly impacts kidney health. Shallow breathing limits oxygen intake, reducing blood flow to the kidneys, especially at night. Conversely, deep, steady diaphragmatic breathing increases oxygen supply, enhances gas exchange, and supports kidney cell regeneration. Japanese experts found that 10 minutes of morning and evening diaphragmatic breathing for 3 months significantly improved glomerular filtration rates. Some even raised their eGFR from 45 to 58 solely through breathing exercises without supplements. Try this simple exercise. Sit upright, inhale slowly through your nose, letting your belly expand. Hold for 3 seconds. Exhale through your mouth, letting your belly contract. Do this twice daily, 10 minutes each time. Simple yet effective. Kidney health doesn't come from luck. It comes from knowledge, action, and consistent healthy habits. What you observe, recognize, and change today ensures peaceful, illness-free golden years. If you've read this far, I believe you're ready to embark on a journey to health with your heart and hands. Don't wait until dialysis to start caring. By then, time is no longer your ally. Subscribe to the Senior Health Vista channel for more valuable, clear, relatable, and practical content for older adults. Each subscription fuels our mission to deliver high-quality, compassionate medical knowledge to those who deserve the best care, you.